Hi, I want to talk to you about what chiropractic can do for pregnancy. As a female chiropractor, and as a mom, I think it's the best thing that you can do for your pregnancy. If you're pregnant or you know someone that's pregnant, chiropractic is the best thing for them. What chiropractors do is we take the subluxation out of the spine. A subluxation is a misalignment of the vertebra that puts pressure on the nerve. Now, not only does the nerve go to your muscles and your ligaments in your nerves, that's why you know you got that owie feeling. The nerve also goes to your organs, and if you're pregnant, it also goes to the developing baby in your uterus or your womb. Now, chiropractic is probably the most safe, effective, and gentle way to make sure that your body functions at 100% and that your baby is getting all that it needs, nutrients, nerve supplies, everything that it needs to grow. The way that a pregnant lady gets adjusted is basically the way that everybody else gets adjusted. Once the lady starts to get a little bigger and the pregnancy advances, of course there are different techniques that you use. You can't lay us down on our stomach as much as we'd love to do that. But there are softer, gentler techniques that the chiropractor can do to adjust you. Now, chiropractic works not only when you are going through your pregnancy, but I have 2 kids, and it was the only thing that helped me through my pregnancies. With my first child, I had sciatica pain, which is that lovely pain going down your leg. And I found if I got adjusted at least once a week, because I was still working, I worked up until she was born, basically. I found if I got adjusted at least once a week, not only did it minimize that sciatic pain that I had, but it also kept me functioning 100%. I was not as tired, I was not as cranky, although my husband probably wouldn't agree to that one. I just felt more in tune and more in balance with my body. And I knew that if I was functioning 100%, then my child was functioning 100%. Now, chiropractic is great when you're about to go into labor, because what it does is they'll realign the pelvis and your sacrum and your lumbar spine. And this way, if everything's where it should be structurally, you'll have an easier delivery time. We've had a lot of referrals from OBs in our area, and what the OB said is that the ladies who had chiropractic care during their pregnancy and before their delivery, they had an easier pregnancy, they had a funner pregnancy, they had an easier delivery. Now, you don't want to stop the chiropractic care just because you've given birth. You definitely need to get adjusted after you've given birth, because you want to make sure everything's realigned, all your nerves are functioning 100%, because then you still have to feed and nourish that baby. And the important thing is that you get your baby in to get adjusted too. My daughter got adjusted, I checked her probably an hour after she was born, and the doctor I was working with came 3 hours later and adjusted her too. So you want to make sure that you give them the best head start in life so they're functioning 100%, so that their nerve supply just really flows, all the information from their brain goes down all to their body. Now, there are many chiropractors who can also turn what they call breech babies. Now, a breech baby is a baby who is either, instead of head down, the baby's tushy is there, or the baby is sideways. Usually the tushy is down instead of the head's down. So there's plenty of techniques that chiropractors know to help turn babies. And we've also had OBs refer us people who have had a breech presentation, and the chiropractors have been pretty successful in turning the babies. Now, let me tell you a quick story. I gave birth at home because I just don't really like hospitals. I was adjusted before I gave birth to her, and she was actually a breech baby. She was called a frank breech presentation, which means her tushy came out first. Was it a hard birth? What did I know? It was my first birth. I just knew that I was on a birthing chair. She came out, we got her checked, she was fine. She was probably about a month old when we went to a chiropractic conference, and she was fussy. Nothing we did could just really calm her down. The chiropractor in charge of the conference said, "Let me check her." Well, what has happened was her sacrum, since she was a breech presentation, her tushy came first, Her sacrum was out of alignment. The chiropractor checked her, laid her down on the table, checked her really gently, handed her back to me. She was still fussy. It wasn't 5 seconds later. She had a massive poop. It was all over the blanket. It was all over her clothes. We had to take her into the bathroom. We had to give her a sink bath because that's what was wrong. Her sacrum was out of alignment. She couldn't poop. As soon as she got adjusted, the 5 seconds later, she was so much happier. She gave a big poop. We washed her. She went right to sleep. The other thing about chiropractic and babies is my cousin had a very difficult delivery. I didn't understand what was going on with her at the time. I went to check the baby, and what I found was her upper cervical vertebra was felt like it was way out in left field. So I'm talking to my cousin and palpating the baby. I go, it kind of feels like her head was stuck. And her eyes got really big. That's what had happened with my cousin's baby. Her head got stuck in the canal. They had to do an emergency C-section to pull her out. So we checked the little girl, and my cousin was like, oh, great, thank you. So if you are pregnant, if you know somebody who's pregnant, if you know somebody who knows somebody who's pregnant, please talk to the chiropractor, the office that you're in, or get that friend or that friend of that friend that's pregnant, get them into the chiropractor and talk about getting adjusted, not only for your health and make sure you're functioning 100%, but also for the baby that's growing in that uterus, in that womb. Make sure that baby gets all the help it can. Get adjusted during your pregnancy, get adjusted right before you give birth, get adjusted after you give birth, and make sure you bring the baby in to get adjusted after you give birth. Because you've just grown and nursed this beautiful child for 9 months, and you're going to protect it from all the things that are out there that us moms want to protect our babies from. You have to not shortchange your child, not shortchange yourself. Please make sure that you get adjusted, you get your children adjusted. And for our family, it's what we do as a family at least twice a week, with my kids running and jumping in their jiu-jitsu classes and their soccer, and just being kids, slipping and falling and wrestling on the floor. So please make sure that you talk to the chiropractor where you are and get all the information that you need about getting your family under care.